And as cases of coronavirus climb in our area and across the country, it's a real concern to all of us that this virus is spreading. But something else also being reported by many healthcare providers and all of us just as alarming: COVID fatigue. In those of us who are well, it's described as the exhaustion from trying to be careful all the time. The everyday things we do, from grocery shopping to going to school or work, usual tasks are anything but usual. They take longer, they're frustrating because you have to stay distant from others and wear masks. And for healthcare providers, it's an even greater concern. Many are working extra shifts, so they are physically exhausted. They also are feeling emotionally drained from, in many cases, being family to those who can't be with their own loved ones. The lines of people supporting them appear to be gone in many cases, and many feel like every time hospital cases surge, they get no let up in their care. But the real concern for them and to us?
Well, I would say that the things that were prudent before COVID remain prudent now. Wash your hands, don't touch your face, cough or sneeze into a shirt sleeve or Kleenex.
So since, as you say, we're all feeling this fatigue, what is it that we should do, in spite of the fact that we're feeling that, to continue the path forward?
Well, I think we have to allow people to retain agency, meaning control. The sad truth is, if you ever want to make people resistant to something, mandate it. Really, the best way to counter this is with good, reliable information, but almost as much as possible, retain agency of the individual to protect their own life and encourage, kind of a conscientiousness about society as a whole.
Dr. Chad Savage, who you heard from there, says the real danger of fatigue is that you just want to give up. Just with any health concern, it reminds us that this is the time when you take risks that you otherwise might not. It is important, he says, however, to acknowledge it so we know it's real, we're all feeling it, and we're not alone in this kind of exhaustion.